Derbyshire Healthcare NHS Foundation Trust, we're primarily a community and mental health services provider. We've got about 2,500 staff. On average, Derbyshire Healthcare's efficiency requirements about £4.5 million a year. So potentially we've got open on our system probably more than 60 projects, 30 of them are being live. So go back probably 2 or 3 years before Cora. There was no single management system at all for projects. Project managers would go off and do what they thought was best for their project. We centrally had no way of collating that information. It's not be surprising to know that projects weren't finishing. We had double counting going on. Imagine running 60 projects on an Excel database. It kept falling over, and that's what drove us to need to do something different. Put simply, the Cora system gives us, it's a single repository for all of our information regarding the programme and regarding the projects. So how are projects performing in terms of finance or in terms of quality or in terms of time. We also use it as a repository of evidence. So we store minutes of project team meetings, we store extracts from the financial ledger, we store all of these things on there so that when we want to truly evaluate a project, we've got the whole picture relating to that particular project. It also provides a rich wealth of data, so management data, management information for us. So before it was very difficult to see that information. Now in my office or actually wherever I am, I can log on to the system and understand what the position is with each of our projects that are operating, what the key risks are. So that level of management information, diceable, sliceable by lots of different levels, is a real positive outcome for us. It can be accessed anywhere. So when I'm down in London and talking to the regulators on my iPad, I can pull up the system, have a look at the system when they're asking me specific questions about the detail. We use it in our Finance and Performance Committee, displaying it on a big screen behind us so that they can see that it's live. Management information very traditionally has been reported at the end of a month. Sometimes 12 days into the beginning of the next month, you're looking 6 weeks backwards. With Cora systems, we are actually reporting live as things were at the end of yesterday, and that makes an enormous difference in terms of managing risk. A really important benefit was being able to reassure and assure the regulators. So in England, NHS Improvement are very keen on the robustness of your assurance systems around your sort of finances. As soon as we started using a recognised system and we were able to sit down and talk our regulators through what we were doing and how we were using the system, that gave them very rapid assurance. So that was a big win for us. That Project Vision through Cora is accessible and is intuitive. I found that the Cora team are very keen to help us optimise the benefits from Cora and are constantly asking us in a supportive way, have you tried to do this? Have you thought about using the system in this way? And that's very positive, and that helps keep us on our toes.